children that have a temperature, when we're giving them pain relief, we're giving them pain relief to improve their comfort levels, as you said. So we're not giving pain relief, so paracetamol, ibuprofen to lower the temperature, because the temperature is not dangerous. In fact, it's actually helpful in fighting the infection.
Hi everyone and welcome back to No Place Like Home. I am your host Larissa and my co-host, beautiful Jessica Prescott.
Hi everyone. Don't feel that beautiful right now, but thank you.
We're at the end of the day. And we are back with the beautiful Nicole Gleeson. Thank you. Nicole is from Rhythm First Aid. We are going to talk more about that in this episode. If you haven't listened to the previous episode with Nicole, go back. She has such a beautiful, beautiful pregnancy, birth and postpartum story.
Yeah, it was so wonderful for us to speak to someone who was so active in preparing for their postpartum. And
all the things.
You reaped the benefits of that. So, for anyone out there who hasn't listened to that, go back and listen.
Go back and listen. But we're going to focus on Rhythm First Aid today, which is your business that you have had for how long now?
5 years.
5 years.
Oh, wow. Here's me asking you in the last episode if you started it in your postpartum. No, Jess.
No.
That's half a decade.
Well,
wow.
yes.
Yeah. That's so impressive.
We're going to talk more specifically today about what is normal infant behaviour. We'll preface it with a disclaimer to say this is not advice.
Not medical advice.
Yeah, it's just general information of what is normal, and of course you know your baby better than anybody else. But for new parents that might be going into parenthood soon or at the very new stages,
and they haven't had much experience with babies.
Well, yeah, they haven't been around babies or, it's completely new to them. What are some normal infant behaviours?
Where do I begin?
I know. Let's start with newborn breathing. Yeah.
Cool. Okay.
I think that's a big one.
Yeah, a big one. And I think it's a big worry. I think people joke a lot about, I check my baby a million times to see if they're still breathing. It is a big thing. And I think as well with tiny newborns, it's normal for their breathing to become or to be irregular at times. And I think that nearly every parent has Googled, my baby is pausing their breathing or they're panting like a dog. Is this normal? And yes, it can be normal. There's always, within that realm of normal. And as you said, Larissa, you know your baby better than anyone else. But if they're otherwise well and you notice within their sleep that their breathing is a little bit irregular, I can give you a bit of a demo like a and then maybe a bit of a pause and then that is normal for a newborn baby.
Okay.
Which sometimes is a little bit daunting, I think.
Yeah.
But again, if there's if that's in conjunction with anything else, then certainly get it checked. And if you're ever worried, like I said, the things we'll chat about, please see your GP or your healthcare professionals. But a couple of things to note about your newborn baby's breathing. Another thing is that babies are primarily nasal breathers. So if a baby has a blocked nose,
that's what I do now. I take my mouth to try and just be at night. Yeah, when I sleep. Yeah.
How is it?
Oh, it's phenomenal.
Yeah,
I have the best sleep of my life.
Yeah, interesting.
Mm-hmm. We digress.
Oh, yeah, sorry.
Do you know about mouth taping? Is this?
Yes, I do. I haven't tried it.
Yeah.
I know someone that needs to try it.
Does it happen to be your husband?
Yes. Babies breathing, So babies primarily breathe through their nose. So and babies, every person and every baby has snot and has secretions. And so if your baby does have a bit of a blocked nose, it can be really hard for them to breathe. Yeah. And the way that I often explain it to parents at work is if they have a cold and they have that increased boogers or increased nasal secretions, it's like us putting a pair of socks in your mouth and you've got a nose full of boogers and it's really hard to breathe. So it's Yeah, so it's why it's quite important to make sure that the baby's nose is clear. And particularly before a feed. Yeah. Because they can't suck from the bottle or suck from the breast if they have a blocked nose.
Oh, I've never even thought of that if a baby's fussing.
Yeah.
Maybe it's because their nose is blocked.
Yeah, sometimes it is. And we see this quite a lot at work, that a baby might have their first cold and the parents are saying, they present to emergency because the baby's not feeding and then they get dehydrated. And it's this sort of vicious cycle, and we just help support them and educate them with cleaning out the baby's nose, and then it allows them to breathe better, to be able to feed, to prevent that dehydration.
I just had a vision of me clearing out one of the kids' noses once. I bought one of those. We just named it the snot sucker. Yeah. Oh my God.
Satisfying?
I found it satisfying. Yeah. John used to vomit and gag. He would run to the other end of the house. But I found it so satisfying because I could see that the kids were like, I know, but I could see that the kids were like, oh, thank you.
But you can also go too hard with those things, right? Like I think there's an electronic one now that sucks. I don't want to say its name because we're probably not allowed to say names, but people will know it if they know it. And I've been told that you got to be careful. There's sort of a fine line with
and I have an electronic one, and I've definitely used it when Ollie has been unwell with a cold, and when his nose is obviously blocked and it's bothering him, and it works really well. So there's a couple of different considerations when cleaning out your baby's nose. You want to make sure that the mucus is always it's not dry. Sorry if people don't like talking about this stuff. Some people will be
squeamish. You need to get used to the stuff when you become a parent. Because
so make sure you spray the nose with saline to loosen up any of those secretions before you suck it out. And you only want to be clearing out their noses when they're unwell and sort of before a feed. I think what you're saying, Jess, is sometimes the more that you suction out, the more secretions that can be produced. So you don't want to get into a habit of doing it all the time.
Okay.
What is the what are your thoughts on? Sorry, I'm touching my breast.
I know. Like, why are you cupping your breast?
Putting breast milk up babies' noses, because we get told to do that to loosen the mucus. Is that
you can do that? Yeah. You can use saline. I've had heaps of saline at home, so I've just used that in a normal sort of nasal spray that you can buy over the counter, or you can also make your own.
Yeah, because I've definitely put my breast milk.
That would be easy. Just put your baby near the boob and squirt some breast milk. Love it. Yeah. Any other breathing?
Yeah, so noses, making sure their noses are clear, particularly in that sort of first 3 to 4 months. Babies' breathing can be irregular, can be normal. The other thing is, I always recommend in our first aid courses, a tip that I share with families is that when your baby is well, after bath time one night, just take a video of their breathing.
Yes.
So that when they are unwell and you're thinking, I'm not sure if their breathing's a bit fast or a bit hard, or I'm not really sure, you can go back to that video. You've got a baseline.
Sets a baseline for what their normal is.
Yeah.
That's a great idea.
And it's really helpful for us health professionals in emergency, because we've never met you or your baby before, so we don't know if they're slightly pale or if their breathing's slightly faster or harder, because everyone's anatomically different as well, right? So parents can say, this is what they usually like and this is what they're like now.
That's such valuable information.
Yeah, such a good little tip.
Yeah.
What about fevers?
Ooh, how long have you got?
Both of my kids are febrile kids, so I feel like this is my territory. I feel like I've got it down pat now. They're 11 and 9, so I've been through the journey.
Of learning. So fevers, if your baby is under the age of 3 months and they have a fever, so a fever is a body temperature over 38 degrees Celsius. So if your baby is under 12 weeks of age and they have a fever, that you need to go and see a doctor. So usually that will be taking them to your nearest emergency department. Sometimes you might go to your GP, just depending on a variety of different factors, but any baby under the age of 12 weeks that has a fever over 38 degrees, they need to see a doctor. And that's because they're just so vulnerable. They can become unwell really quickly, and we want to know exactly what is going on in their body. So what infections that they have that is creating that febrile response. Really, really, really important. Another key message from a paediatric emergency department is that please only use an under the arm or an axilla thermometer to check your baby's temperature.
I was going to ask about thermometers. So
under the arm or
under the axilla. So it's under the arm thermometer.
Okay.
So one of those cheap sort of $15, $20 thermometers.
Yep.
It's got a little screen on it. It's digital with a few numbers on it. Push a button, place the thermometer underneath the baby's arm and hold it in place. It will beep, and then often you need to hold it for even longer after it beeps until the numbers stop going up.
Okay, because I had one of those and I thought I was a bad mum for not having one of the
No.
You know, the ones that you hold up to the forehead. So then I went and spent $90 odd on this was recent that I bought one of the good ones. But I was fine with my cheap.
I use the ear one.
Yeah, ear ones are great, but you just can't use them on tiny newborns because the baby's ears are too small for it to be accurate.
Yeah.
Jess, you're not a bad mum. If you're a bad mum, I'm a bad mum because I've got a 1-year-old now and I still use the under-the-arm thermometer.
Okay.
And I have no intentions of buying a different thermometer.
Okay,
It's the
great.
most accurate way. So even in Larissa, your 9 and 11-year-olds, you can use, ear thermometers or whatever type of thermometers, but an under-the-arm is still the most accurate. Even on AFLs,
Okay.
I know this is going to sound absolutely insane, and I'm definitely not saying that anybody should not use a thermometer, but I can tell when my kids have a fever just by touching them. Like you can feel it in their hands and their feet, like and it's all you didn't get the thermometer out just to check. But isn't it wild how we just get to know our kids in that way that you can just know.
Yeah, and it's really important to have an under-the-arm thermometer and to know when your baby has a temperature under the age of 3 months. But above that, you don't really need to know exactly what their body temperature is. And as you said, Jess and Larissa, like you both can tell when your child has a fever. And I know this from work when parents would say, buzz me and say, hey, Nicole, can you come and check my child's temperature? They feel hot and they might not have a fever. I said, I guarantee you they'll have one in half an hour because you know your child and you can feel that they're hot, and they do every time.
Yeah.
And even when Ollie's been sick in the last few months, he's had quite a few colds, so he's had fevers with those. I've just checked his temperature maybe like once each time that he's been unwell. And it's almost sort of for my mindset being like, okay, when he feels like this, he does have a fever. So I sort of know I don't bother to check his temperature again throughout the illness. It doesn't matter what his temperature is because he's unwell. It's obvious to me that he's got a runny nose, he's got a cough, he's got a cold. His body's heating up, fighting off the infection. It doesn't matter what the thermometer says. You don't need to continue to check.
I know we are talking about infants, but I just want to ask you a question about slightly older kids. What are your thoughts on, so I know that when you have a fever, it's your body fighting infection, but also what are your thoughts on when to give pain relief to help lower the fever? Is that something you would avoid entirely, or is that something you would do to sort of reduce their discomfort if you just want to help them have a sleep? And can you do that for, I guess we can link it back to newborns, because can you do anything for newborns for their fevers?
Yeah, so for children that have a temperature, when we're giving them pain relief, we're giving them pain relief to improve their comfort levels, as you said. So we're not giving pain relief, so paracetamol, ibuprofen to lower the temperature, because the temperature is not dangerous. In fact, it's actually helpful in fighting off the infection.
But not a lot of people know that. Having febrile kids, when I say, oh, yes, Seb had a temp of 40, which I know that's high, I'm not minimising it, but for us, unfortunately, that's just our normal. And I don't give any pain medication only because particularly Seb, he will say, Mum, I don't need it. I'm okay. I just want to have a lukewarm bath or, I just want to whatever. But so many of my girlfriends will just smash their kids with Panadol or Nurofen and they say to me, I don't understand how Seb's gotten rid of his fever taking nothing in 2 days. And I've been giving so-and-so Panadol for 4 days.
And doesn't that actually impact your gut health, which would then make your immune system not as strong? Sorry, I probably shouldn't even say that on the podcast. We're going on a real tangent.
Yeah, I know.
The key messages are, if your child is over the age of 3 months and they have a fever, we want to know why they have a fever. So if it's obvious that they've got a respiratory tract infection, you'd follow the directions on the box. You don't want to be giving pain relief to lower the temperature.
But that's where we were coming. I think that's where we started. So I think the misconception from what I've experienced is that you're giving the pain medication to lower the temperature.
Yes.
And what you're saying is that's actually not the reason.
People do that, but you don't need to.
Yeah.
You're giving the pain relief to improve their comfort levels.
Yeah, okay.
And I think where that comes from, Larissa, is there's so many myths and misconceptions about fever. The information that we have and our current practice is really, really different to 30 years ago. And the way that, the past generation managed our fevers is really different. Fever is not harmful.
Yeah, my mum is beside herself whenever my kids have
and
fever.
It's really that's a really common theme that we see. Fever is not harmful. I want you to think about that message, and that the number on the thermometer is not indicative of how unwell your child is. So Larissa, your child that has a temperature of 40 degrees versus Jess, if your child had a temperature of 38.2, it doesn't mean that either child is more unwell than the other. It's, you know, taking into consideration that bigger picture. What else is happening? Like, how's their behaviour? How are their hydration levels? How is their breathing? What other symptoms do they have? Not sure if I answered your question or if I've just gone on a tangent.
Yeah.
No. You have completely. Yeah. And you're right. It is those other factors because I will look at those. I'll say, okay, well, he hasn't lost his appetite. Yeah, he's more tired, but he says, I just need to have a sleep or I just want to have a rest or whatever.
Yeah.
And then what about febrile seizures? Because I know a lot of people, you know, when their babies get a fever, they try and cool them down by throwing them in a cold shower, but that's bad.
Yeah, you shouldn't do that. No, that is bad. Yeah.
Yeah.
So febrile, a lot of people worry about fever because they think that fever is harmful or that it might cause a seizure. And a febrile convulsion is something that can happen in a child. 1 in 30 kids will have a febrile convulsion. So between the age of 6 months and 6 years. And what causes a febrile convulsion is a rapid change in body temperature that causes that seizure. Children have lower seizure thresholds. It's not that high temperature that causes a seizure.
Gotcha.
So if your child was going to have a febrile convulsion, there's nothing that you can do to prevent it. There's nothing that you can do to stop it. If it's going to happen, it will. So by giving these medications like paracetamol, ibuprofen, isn't going to help, unfortunately. Febrile convulsions or febrile seizures are really scary to watch. It's when a child will become unconscious. And so you won't be able to wake them up and they'll be really stiff or they'll be stiff and have jerking movements. Sometimes they might be bright red in the face. Sometimes they might even go slightly blue in the face. And this seizure that they have is safe. Like I said, it's very scary. It's very terrifying. If you notice your child was having a seizure for the first time, you would call an ambulance, place them onto their side, make sure that they're safe. Stay with them, keep chatting to them, keep an eye on their breathing, making sure their breathing remains regular. And these febrile convulsions most of the time stop on their own. But I don't want you to be afraid of them because if it's going to happen, it's going to happen. It's one of those things that you can't control. And you think about a classroom at school, or not many classrooms have probably got 30 kids in them these days, but approximately 1 kid in a classroom will have a febrile convulsion. But yeah, it's a rapid change in temperature. It's not, oh crap, they've got, you know, a 41 degree temperature. They're going to have a seizure, which is I think what a lot of people think.
Yeah. I think the conception is the worse the fever gets, the more likely they are to have it.
Yeah.
Whereas it's the rapid change, like you say. So throwing them in the shower is the worst thing you could do.
Exactly right. And that reminds me, Jess, so the febrile convulsion is caused by the rapid change in temperature. So usually that's from a normal temperature to a higher temperature. But if you cooled a child really quickly, so you put a child in a cold bath, they could.
It's going to do the same thing.
Yeah, potentially, which is why it's not recommended to cool a child too quickly or to place them in a cold bath. Yeah.
Interesting. So many misconceptions out there.
So many.
And it must be so hard for you as an educator to be, you know, trying to make sure that people are doing the right thing.
Yeah. Well, and I think it's sort of, it is really hard. And like we said in the previous episode, that you focus so much on the birth and then, you know, all of a sudden you're faced with postpartum and all of a sudden you're faced with the health of your baby. But if you are proactive in your education, like we're trying to encourage everyone to do, you know, having these conversations about fever and about breathing is what we have in our first aid course.
Yeah.
So you can come and chat to one of us peds nurses and we will talk about these things. So when your baby does have a cold, you'll know about them only breathing through their nose and you'll know about keeping an eye on this. And when they have a fever, you'll know about these red flags and things to look out for, which will help you hopefully to feel a little bit more comfortable and make things a bit easier.
Let's talk about coughs and colds.
Yes.
So at what point would you take your baby to see a healthcare professional?
So it depends on their age.
Yeah.
And it depends on a lot of factors. There's a lot of factors, but things to consider is how else they are, how well they are within themselves. So how's their drinking going? How are their wet nappies? How's their breathing? How's their behaviour? also, how old they are. If you're at all concerned that your child's got a cough and cold symptoms, definitely take them to go and see your doctor. If your child has had a few colds and you've got a bit more experience in education, you might be comfortable to be at home for a day or two or a little bit longer, particularly if it's not your first baby. You might have a toddler at home that has a few coughs and colds and they might share.
Yeah.
Sharing is caring.
Daycare bugs.
with their little sibling. But in terms of when seeing a doctor, we always say as a generalised advice that if a child has a fever for more than 48 hours, if they are struggling, have any problems with their breathing or if their hydration, so what they're drinking and popping in, or their output is less than 50%. At all times that you need to see a doctor.
Right.
So breathing, appearance, hydration.
Big one. Mm-hmm. Okay.
And what about rashes?
Yeah, rashes also. How long have you got for that?
I know about blanching. I know about,
Yeah, let's chat about that.
Yeah.
About what?
Blanching. So if you, you should be saying.
No.
So if a child has a rash and you press on it with a finger or like what I did to your chest yesterday when I saw how tanned you are, and it goes white, then it's okay. But if it stays red when you press your finger or thumb on it, then that's when it's I don't know what the proper name is, but a scary rash is what I would call it. Yeah.
So you can have lots of different rashes. Most rashes are okay and are safe rashes. Starting from that newborn population, there's lots of different reasons why babies get rashes. They have those hormonal rashes. And
also so many babies react to clothing that hasn't been washed and people don't realise. And it's just because you get that cute outfit and you want to put it on them. But they, all the clothes, all the cotton is sprayed with so many chemicals.
Yeah. And thinking about where
bedding
your
too.
Environmental, bedding, what laundry detergent you have, all of that type of thing. Lots of babies get eczema. 1 in 3 kids are having eczema. So eczema is a rash. Lots of different reasons why babies have rashes. Drooling rash, heat rash, nappy rash. Because it's a
teething
Wednesday.
Rash.
Yeah, teething
Wednesday rash.
Yeah. But the thing you're talking about, Jess, is an important thing to understand with rashes. So you're assessing if your child has a blanch or your baby has a blanching rash or a non-blanching rash. And so the type of rash that usually looks like is red or purple little pinprick spots. So if you can find like a freckle or something on your hand or your arm, and if you push on your freckle, you'll see that the freckle doesn't change colour. The skin around it does. So if that freckle wasn't usually there and you saw that there was sort of some red and purple spots and they didn't blanch, so a freckle is a non-blanching spot, then you would be thinking about what that potentially could be. So the recommendation is if a child has a fever and a non-blanching rash, so they should be taken to a doctor.
Right.
So a rash, say for example, if I had a bit of sunburn or eczema or most of those other types of rashes, most viral rashes are blanching. So when you push your finger on them or sort of rub your finger up your skin will turn to its normal colour. For me, it's quite pasty and white.
I mean, it is winter.
And return to its normal colour. So the thing that we're worrying about with that is the meningococcal rash. It's a non-blanching rash.
I knew someone who passed away from that as a teen, as a late teen. But I remember when that happened, and then I had children. That was one of my
it's such
greatest.
a fear, isn't it?
Yeah, it really was.
I've looked after a couple of children that have had meningococcal, and I guess a message to parents is that the rash is a really late sign, and so I'm really confident that all parents would be able to be able to pick up on the cues of their baby if they're really unwell, that they'd have a fever and that they'd be really irritable. And the children that I've cared for that have had meningococcal, they haven't developed a rash until they'd been in hospital for many hours. So the parents were able to assess and identify that their babies and children weren't right. And so I just want parents to know that the rash is often quite a late sign. There are other things that cause this non-blanching rash that are not dangerous and are not harmful, but of course you need to go to a doctor, have an assessment, and potentially a blood test to rule out the potential of meningococcal. There's a variety of meningococcal vaccinations that are recommended as well, which help to decrease the risk of your child contracting meningococcal.
Yeah.
Yeah.
What on that, it's kind of a really good segue. What level of first aid should parents be having that's proficient enough versus sort of what should then be left to going to a healthcare professional?
Do you mean that sort of first aid care?
Yeah. So as a parent doing first aid, what is, so if someone came to you and did that first aid course, that would be comprehensive enough for them to make really good assessments.
Yeah. And that's what we want. You know, we don't want parents and care providers to be, caregivers to be diagnosing their children. That's not your role as a parent.
Yeah.
Like your role, and even if you're a healthcare professional, I know that myself, when I've been on the other side, when I've had to take my child to emergency, it's not my role to help diagnose the child. And, you know, it's your role to be a parent and to identify what's normal and what's not.
Symptoms.
And at what point am I concerned?
Yeah, okay.
And so by, you know, increasing your health literacy through reputable resources is really important. Be careful of where you're consuming your health information. It helps set those foundations for you to make good decisions, I guess. Of identifying sort of the red flags in your children.
Yeah.
And when to take them to a doctor, when to take them to an emergency department.
And I guess, like, to come back to your question of what level of first aid should we be proficient in as parents, like basic CPR and like burn, what else?
Yeah, choking, seizures,
choking. Oh my gosh,
allergies, anaphylaxis.
Choking.
Yeah. So the Royal Children's Hospital recommends that every parent and caregiver attends a first aid course.
Yeah.
And this training should be updated regularly.
Yeah.
And a lot of people say to us, I've done a first aid course, and they may have done a first aid course at work through their workplace, which is great that they have that basic knowledge of first aid, but that's usually adult based.
I was going to say it's not, there's no child.
And it's just infants are just skimmed over. And you don't get that information from us paediatric nurses about the fevers and the febrile convulsions and the rashes and the allergies and the choking and, you know, the head injuries and all of those things. Sort of the first aid course is a lot more than a first aid course. It's a lot more
comprehensive.
Comprehensive, but speaking about illnesses and sicknesses and viruses, you know, the
things that happened at that infant sort of stage.
Yeah. And we help you to also steer you in the right directions of where to find the information and give you resources to sort of empower you on your way. You're not expected to ever remember anything, but think, this is what I need to do in this situation. This is where I need to go to get this information.
I mean, we did a first aid course, sadly not with you, but we did a first aid course, the whole team, before we opened. And the CPR that you do on an adult versus a child or a baby is so different.
It is.
And it's, you know, if people aren't learning that. I did it when I was I did my first aid course when I was pregnant with my second child, and only because, and I'm sure anyone, like, there'll be a lot of people listening to this who will remember that poor mother in Tasmania who lost her child and while she was pregnant, and he choked on a bouncy ball, and she was performing CPR on him and he didn't make it. It was the day before his 4th birthday. And so I had a child that age and I was pregnant, and I was like, book me into the next. And it's really bad that it took someone else's tragedy to force, you know, to get me to the point where I was going to do a first aid course. It should just be something along with the list of other things that we want people to do while they're pregnant, but everyone should just be doing that while they're pregnant and doing top-ups, because I until we'd done the one before we opened, I'd forgotten most of it. And
I'm a big believer that it really, having that sort of knowledge and having that basis, it does help you sleep better at night, because you're not as concerned about the tiny little things and these little misadventures and accidents and things that happen.
Yeah.
You have that knowledge basis and you know where to go to get help and when to get help.
Yeah.
You're not sort of as worried, and, you know, we know this from feedback of people that have completed a first aid course.
Yeah. We will put all the links and everything up to Rhythm
your
First
Instagram,
Aid.
your website.
Yeah, we will. So for people who haven't done it and would like to, on that note, thank you so much for being with us. We've really enjoyed it today. I've learnt certainly a lot. Thank you very much.
Pleasure. Thanks for having me on.
You're welcome.
This podcast represents the opinions of our hosts and their guest speakers. Views and opinions expressed in the podcast are our own and do not represent that of our places of work. This podcast is for informational purposes only, and content here should not be taken as medical or professional advice. Please consult your healthcare professional for any personal recommendations and medical care. While we make every effort to ensure that the information we are sharing is accurate based on the best available information at the time of recording, we welcome any comments, suggestions or feedback via our website contact form, home.com.au/contact. Names and details of personal experiences may have been changed to allow for anonymity and privacy. To join the conversation, join us on social media at Home Postpartum.